Southeast Asian nation of Malaysia is located slightly north of the equator and is divided into two non-contiguous areas. East Malaysia, which is Malaysia Timur, which is located on the island of Borneo and Peninsula Malaysia. Semenanjung, Malaysia, also known as West Malaysia, Malaysia Barat, which is located on the Malay Peninsula. The administrative center of Malaysia is Putrajaya, situated roughly 16 miles, which is 25 kilometers south of Kuala Lumpur, which is situated on the western portion of the peninsula, approximately 25 miles, 40 kilometers from the shore. The two largest states of Malaysia is Sarawak and Sabah. Malaysians are divided unevenly between Peninsular and East Malaysian regions, with the majority residing in Peninsular Malaysia. There is a lot of ethnic, linguistic, cultural, and religious diversity in the population. The service sector, contributing between 60 and 70% of GDP and employment, post-industrial economies are characterized by a dominant service sector. The expansion of service is closely linked to both income growth and economic modernization and is acknowledged as a crucial component of economic progress. As part of the national plan to diversify the sources of development, policy adjustments are currently being implemented to reinforce the natural transition towards an economy dominated by service. In Malaysia, education services cover a wide range of program, organization, and structure designed to give people access to opportunities for learning, growth, and development. The Ministry of Education is principally in charge of overseeing education service in Malaysia, which are intended to meet the various demands of the populace. Institutions of higher education. These include college, universities, and other post-secondary establishments that provide certificates, degree programs, and diplomas in a range of subjects. Malaysia's education services are always changing to meet the demand of a world that is changing quickly. They are incorporating technology, encouraging creative teaching approach, and adjusting the demands of a knowledge-based economy. In Malaysia, the term health services refers to a broad range of initiative resources and plans aimed at advancing, preserving, and regaining the health of people and communities all around the nation. To put it more simply, medical care and treatment are included in Malaysia health services. This refers to medical facilities such as hospitals, clinics, and healthcare centers where patients can be obtained diagnosis, treatment, and care for a range of medical conditions. Travel for medical purposes due to its excellent standard of healthcare, highly qualified medical staff, state-of-the-art facilities, and reasonably priced charges as compared to certain other nations. Malaysia has grown in popularity as a destination for people seeking medical care from other countries. Malaysia's healthcare industry benefits greatly from the international patient market, which not only promotes the interchange of medical information and skills but also brings economic benefits through medical tourism, ultimately improving Malaysia's reputation for quality healthcare worldwide.
Malaysia's education is improving. New public and private universities offer more opportunities. Government-backed public universities provide affordable education, while private ones funded by business operate commercially with fees matching their services. Malaysia's education changes aim to create skilled workers for an economy lacking labor and skills. Public and private sectors collaborate in higher education, making Malaysia a regional center of excellence. New universities improve access, boosting enrollment, and the National Accreditation Board ensures education quality. From 2001 to 2010, Malaysia's Education Ministry's plan made it a regional hub for top-notch higher education. Private sector investment caused significant growth, doubling student enrollment in private universities from 1997 to 2001. Public institutions also saw an increase with around 0.5 million students in tertiary education in 2001 and 68% attended private university. The government promoted private sector involvement in higher education, resulting in the growth of private colleges and universities. This expanded students' access to diverse educational opportunities. Accreditation systems were introduced to maintain high standards, focusing on specific levels of instruction and academic excellence. Between 1990 and 2001, Malaysia's higher education sector saw significant growth, emphasizing improved access, diverse choices, quality assurance, and alignment with the global economy to make the country a regional hub for excellent higher education. Malaysian education institutions attract foreign students and revenue, acting as exporters of higher education services. The country positioned itself as a regional education hub with programs aligned with global standards. Accredited schools known for affordable and high quality education attract international students. In 2001, 72% of Malaysia's 18,245 international students were in private school, generating about 225 million in foreign exchange revenues. Although foreigners made up only 3% of higher education students in 2001, the number grew significantly to 36,466 by January 1, 2003, showing a sizable market for exporting education services. Malaysia's universities offer diverse programs in arts, science, businesses, engineering, and medical fields, appealing to a wide range of interests for international students. China leads with 11,058 international students in Malaysia, followed by Singapore, Thailand, Indonesia, and India. Students from the Middle East rose from 901 in 2002 to 2,173 by January 1, 2003. Many prefer engineering, business, and information technology programs linked to global recognized institutions with flexible entry requirements. Malaysia's appeal lies in affordable living expenses and tuition rates compared to Western nations, making it a cost-effective option, especially when compared to its main rival, Singapore. Malaysia's diverse and multicultural environment attracts international students, fostering a positive learning and cross-cultural interaction. Despite concern, the country is considered reasonably safe. In conclusion, Malaysia has significant potential in exporting higher education services due to factors like quality instruction, affordability, diverse programs, international partnerships, supportive government policies, multicultural atmosphere, growing reputation, and excellent infrastructure, making it an appealing destination for higher education and expanding its export sector in this field.
Content 2 is Malaysian healthcare services. The first point is international patient market in Malaysia. The figure shown is the revenue from medical tourism in Malaysia from 2013 to 2022. The number of international patients visiting Malaysia for medical care has surged in recent years. Based on the figure above, medical tourism brought in around 1.3 billion Malaysian ringgit in income in 2022. Based mostly on recommendations, international patients choose Malaysia. Malaysia sought healthcare primarily for a variety of reasons. First and foremost, high-quality medical services. Additionally, reasonable costing. Moreover, medical professionals with international training. The National Committee for the Promotion of Medical and Health Tourism was founded in 1998, marking the beginning of the promotion of health tourism. The second point is the potential for exporting healthcare services. Malaysia's international patient market is very modest, although it has expanded quickly in the last several years. It must focus on regions where there is excess capacity to export healthcare services due to the acute scarcity of healthcare facilities to fulfill local requirements. There are good opportunities for the export of health services in fields including alternative medicine, eye care, cosmetic surgery, dentistry, beauty and health programs, and the like. This can be seen when international patients seeking holistic and non-conventional therapies are drawn to traditional and alternative medicine including naturopathy, Ayurveda, and traditional Chinese medicine. Besides, patients are increasingly traveling overseas for dental procedures such as oral surgery, cosmetic dentistry, and dental implants. This trend is known as dental tourism. Moreover, people seeking preventative healthcare and rejuvenation are drawn to wellness and health programs, which include spa treatments, fitness gateways, and holistic well-being packages. A more coordinated approach should be taken to the ongoing promotion of health tourism in the intended market. In order to realize its full potential and seize its possibilities, Malaysia must keep enhancing the domestic healthcare system.
The national policy to re-engineer the economy with an emphasis on domestic sources of growth revolve around the service sector. There are very strong arguments in favor of Malaysia expanding its service industry. As the population ages and economic level rise, so does the need for services. Additionally, there is a growing integration of services activities amongst enterprises that provide products and services as the economy advance. Most service-related jobs are usually skill-based rather than capital-intensive. For nations with limited resources and a workforce that is becoming more educated, there are therefore excellent sources of growth. Both education and healthcare show promising prospects for further development as engine of growth and export earnings. However, Malaysia must guarantee a sufficient supply of trained labor and implemented quality assurance to match international standards in order to fully realize the growth potential of these businesses.